Okay, so the final special senses section is going to be injuries and disorders of the nose and the tongue. The reason that I put these together is because smell and taste, as you know, are directly connected. They think up to 90% of taste actually comes from what we smell, that retronasal olfaction. Um, so the parts of the particles that travel up. So there's the oral cavity, they travel up this way through the pharynx to the nose and then are smelled that way. So it's retronasal olfaction. Um, so because they're so directly connected, it made sense to me to talk about the disorders together. So that's what we're gonna do. So this is just like a smattering of diseases and disorders. Obviously, there are many more, but just a few. So the first is rhinitis. So rhino refers to the nose. That's why a rhinoceros is called a rhino because it has a big horn on its nose. Rhinoplasty is the name for surgery on the nose, like plastic surgery in particular is known as rhinoplasty. So rhino is nose. So rhinitis is inflammation of kind of the nasal area. Because, as we learned, everything is connected back there, rhinitis doesn't just affect the nasal cavity. So it can cause your eyes to become itchy. It's not really going to affect sight at all, but your eyes are going to maybe feel uncomfortable. Um, your nose might be congested, um, runny, because the mucous membranes are creating extra mucus. Um, you might also sneeze to kind of help clear away foreign particles that are in your nasal area. Because you're congested, you have extra mucus here that might drip down, down the back through the pharynx. So it's called post-nasal drip behind the nose. Drip. So that might cause you to have an itchy or a sore throat. It might cause you to have a cough as well to try to clear out some of that phlegm. And then taste will also be affected because if your nose is all congested, you're not getting that retronasal olfaction. So you're not able to smell, so you're not really able to taste very well either. We talked about the eustachian tube, which runs from the middle ear down. Looks like maybe right there in this picture. And so if your nose is stuffed up, then your ears might also feel stuffed up, so it might affect the hearing as well. Okay. Rhinitis can be caused by a variety of things, anything that's going to inflame those mucous membranes. Commonly, colds and allergies were coming up. I can see the flowers starting to bloom, which is always the sign that allergy season is going to start in the valley, which is hardly anybody's favorite time of year. So, rhinitis is going to affect, like I said, mostly taste and smell as far as senses go. It could have some impact on hearing if your ears get really stopped up when your nose does. Sight, it might affect your eyes, but not like your sight necessarily. Just kind of your eyes will feel icky. Next, another fairly common problem or issue is an issue with the septum. So here is the septum. It's the structure that divides the two nostrils. Okay, so it's made of bone and cartilage. And the purpose of the septum, that division, is to help airflow without turbulence, right? So it helps it flow smoothly through the nose and then down ultimately into the lungs. So one issue people have with their septum is it can be deviated, which means instead of being like straight up and down, right, symmetrically in between, it can kind of go off to one side. And so that can cause like problems breathing. It can cause stuffiness on one side of the nose because things can't sort of drain and move around properly. Um, Trouble sleeping because of snoring, things like that. So sometimes if it's severe enough, surgery is one way of fixing an extremely deviated septum. Septum problems can also be caused by things like drug use, working with chemicals, um, anything that's going to place like pressure or like a piercing, for instance, or something that's going to bring chemicals that can damage that tissue. Uh, so those can also cause septum issues. Okay, I'm going to pause and write some things down. So I just wrote some of those things that I mentioned. So deviated septum um, tends to be more genetic because it's like structural, the way the bone and cartilage grow in your face. Perforation is usually caused, as you see, by drug use, chemical inhalations, if you're working in a job with lots of chemicals, or certain, like if you have to use like a steroidal nasal spray, that can cause damage. Chemotherapy, which damages so many things, can also damage potentially the septum. And then obviously a piercing is going to pierce and perforate the septum if you got a piercing in your septum. So all of those things can have sort of similar effects to what you see with a deviated septum, kind of indifferent, depending on the severity. So it can cause breathing issues because the airflow is not as smooth. It creates some turbulence when you have, potentially, when you have a hole in the septum. So there are treatments. There is just looking, there's something called a prosthetic button that they can make and put in a hole in the septum to fix it. But just one of those things that, like, we don't think about it a lot, that it's important to treat it with care. Next slide has a couple of pictures of perforations to the septum, and one is to the septum and the palate. So if that kind of stuff freaks you out, um, skip ahead a little bit. So here you can see a septal perforation here. So you can see the Q-tip going through. This one is really terrible. So this is the palate, so inside of the mouth, the roof of the mouth, and then up, and then the septum is also perforated up there. This situation can be a result of inhaled drug use. And obviously this is going to create, breathing issues. But this is going to create breathing issues in addition to issues with swallowing and things like that. So you really want not to engage in behaviors uh, that are going to cause any of these results. Okay, so disorders of the tongue um, obviously are going to affect taste. They are kind of similar to what we've talked about in terms of um, the nose, disorders of smell. Um, so I'll just talk about them generally. Um, so the first one would be an infection. Your tongue, as you might expect, has a lot of bacteria um, living in there, which some of it is good and helpful, and some of it is less good and less helpful. But if you got an injury to your tongue, like you could bite it, for instance, um, or I don't know, injure it in some other way, that bacteria potentially could cause an infection. And so then you would obviously have trouble tasting. You'd need maybe some antibiotics to help take care of it, but it could damage the papillae, which then would affect the taste buds, of course. Um, an injury to the tongue, as I said, you might like bite it, for instance. I'm sure we've all experienced that. Might burn your tongue. You were drinking hot chocolate, for instance, in the morning and it was a little too warm. Burn your tongue. It happens to me all the time. And so that burn then is going to affect, again, the papillae, which is going to affect your sense of taste, even though maybe your retronasal olfaction is working plenty well. If you're not getting that taste bud reception, your taste isn't going to be working as well. It is possible to get growths on your tongue, like a tumor, for instance, um, or other sores. So those can affect your taste buds and thus your sense of taste. And of course, drugs can affect taste buds and the sense of taste as well. Chemotherapy isn't really what we think of when we think of as drugs, but it certainly fits in this category for this portion because the taste buds and the surface of the tongue, those cells grow relatively quickly. They can be affected by the chemicals in chemotherapy, and so that can also affect the sense of taste as well. So you just have to be really careful with your senses, and do your best not to damage them, so they work and do their job. You can live a long, happy life tasting food, hopefully. Um, all right, so that's it. Uh, yeah, have a good day.